Every year, thousands of seniors face this exact moment. The statistics are sobering. 1 in 5 heart attacks happens when people are by themselves, with no family member, no neighbor, and no friend within reach. Many believe they'll have warning signs for days, or that help will somehow magically appear. But the harsh reality is that heart attacks don't wait for convenient moments, and they don't announce themselves with dramatic Hollywood chest-clutching scenes. Here's what most people don't realize. You have more power than you think. Even when you're alone, even when panic tries to take over, there are specific actions you can take that could mean the difference between life and death. These aren't complicated medical procedures or fitness routines. They're simple, practical steps that any senior can remember and perform, even under pressure. In the next few minutes, we're going to walk through 7 critical strategies that could save your life during those precious first moments of a heart attack. Before we start, tell us where you're watching from. We read every comment. And don't forget to subscribe. Let's move on to the first trick. 1. Master the art of reading your body's whispers. Your body has been your faithful companion for decades, and it rarely lies to you. When a heart attack begins, it doesn't always roar. Sometimes it whispers. Learning to hear these whispers could be the most important skill you ever develop. Forget everything you've seen in movies about dramatic chest pain. Real heart attacks often start with sensations that feel almost ordinary. You might notice a dull ache that feels like you slept wrong, or a pressure in your chest that reminds you of heartburn after a heavy meal. Some people describe it as feeling like someone is slowly tightening a belt around their chest, or like they're wearing a shirt that suddenly become too small. The pain doesn't always stay in your chest either. It can travel to your left arm, your right arm, or both. Sometimes it settles in your neck or jaw, making you think you have a toothache or stiff neck. Women and seniors, especially, might feel pain in their back, between their shoulder blades, or even in their stomach area. But there's more to watch for than just pain. You might suddenly feel short of breath while doing something as simple as folding laundry or walking to the mailbox. Some people break out in a cold sweat for no apparent reason, or feel nauseated like they're coming down with the flu. Dizziness, lightheadedness, or feeling like you might faint are also warning signs that many people dismiss as just getting older. It could be a small feeling of discomfort, like indigestion. Paying attention to your body for subtle signs and calling for help will go a long way. Your intuition is powerful, especially after decades of living in your body. If something feels off, if you catch yourself thinking, "This isn't normal for me," trust that instinct. Don't talk yourself out of it. Don't wait to see if it passes. And definitely don't worry about feeling embarrassed if it turns out to be nothing serious. Before we move on, remember this. Your body whispers before it screams, and those whispers are your chance to act. 2. The 911 call that becomes your lifeline. The moment you suspect something serious is happening to your heart, your phone becomes the most important tool in your house. But this isn't just about dialing 911. It's about making that call work for you in the most effective way possible. First, call immediately. Don't wait to see if the symptoms improve. Don't try to call a family member first. Don't attempt to drive yourself anywhere. Every single minute that passes during a heart attack means more damage to your heart muscle. When you call 911, you're not just getting a ride to the hospital. You're bringing a mobile emergency room to your front door. When the dispatcher answers, speak clearly and say, "I think I'm having a heart attack." Don't downplay it. Don't say you're not sure. And don't apologize for bothering them. Give them your exact address, including apartment numbers or any special instructions for finding your home. If you live in a complex or hard-to-find location, mention nearby landmarks. Stay on the line. The dispatcher is trained to guide you through these crucial minutes, and their calm voice can help keep you focused. They might ask you to take aspirin if you have it and aren't allergic. They'll also want to know about your symptoms, your age, and any medications you're taking. Here's something most people don't know. If you have a smartphone, switch to speaker mode after giving your address. This frees up your hands and makes it easier to breathe. Keep the phone close by, but don't feel like you have to hold it. The dispatcher can still hear you, and you can still hear their reassuring voice. If you start feeling confused or have trouble talking, don't hang up. The dispatcher will stay connected and can hear what's happening, even if you can't respond. This helps them guide the paramedics to you and prepare them for what they'll find when they arrive. Before we move on, lock this in. When in doubt, make the call. It's always better to be wrong about a heart attack than to be wrong about not having one. 3. The simple pill that packs a powerful punch. In your medicine cabinet right now, you probably have one of the most effective heart attack treatments ever discovered. It's not expensive, it doesn't require a prescription, and it's been saving lives for decades. It's ordinary aspirin, but when used correctly during a heart attack, it becomes extraordinary. Aspirin works by thinning your blood and helping to dissolve the clot that's likely blocking one of your heart arteries. But here's the crucial part. You need to chew it, not swallow it whole. Chewing gets the aspirin into your bloodstream much faster, sometimes in as little as 5 minutes instead of 30. Take 1 regular strength aspirin, 325 milligrams, if you have it. If you only have low dose aspirin, 81 milligrams, take 4 of them. Chew them slowly and thoroughly, even though they taste bitter. Don't worry about taking them with food or water. In this situation, getting the aspirin working quickly is more important than protecting your stomach. But there are important exceptions. Don't take aspirin if you're allergic to it, if you're already on blood-thinning medication like warfarin, or if you have a bleeding disorder. If you're not sure, it's usually safer to take it than not. But this is something to discuss with your doctor ahead of time. Keep aspirin easily accessible, not buried in a medicine cabinet, but somewhere you can reach it quickly. Some people keep a bottle in their kitchen, bedroom, and living room. Make sure it hasn't expired, and consider getting the kind that comes in individual packets if you travel or spend time away from home. The key is acting fast. Don't spend time looking up dosing information or reading the bottle. If you think you're having a heart attack, chew the aspirin first and sort out the details later. Just to lock it in, chewing aspirin during a heart attack isn't just helpful. It's one of the most powerful things you can do to save your own life. 4. The position that gives your heart a fighting chance. Once you've called for help and taken aspirin, your next move might be the simplest but most crucial decision you make: where and how you position your body. This isn't about comfort. It's about giving your struggling heart the best possible chance to keep working until help arrives. Stop whatever you're doing immediately. Don't try to finish tasks. Don't clean up around the house. And don't worry about how things look for the paramedics. Every bit of physical activity puts additional strain on your heart when it's already fighting for your life. Find the most comfortable place to sit or lie down. A recliner is ideal because it supports your back while keeping your head slightly elevated. If you don't have a recliner, sit on a couch with pillows behind your back, or in a sturdy chair with armrests. The goal is to be supported without slouching, which can make breathing harder. If you feel dizzy or like you might faint, lie down on your side with your head propped up on a pillow. Avoid lying flat on your back if you're having trouble breathing. Some people find it easier to breathe sitting up, while others prefer lying down. Listen to what your body needs. Keep your arms relaxed at your sides or resting on armrests. Don't cross them over your chest or clutch at your shirt. Loosen any tight clothing around your neck or waist. If you're wearing a tie, loosen it. If your collar feels tight, unbutton it. Every small thing that makes breathing easier helps. This is also the time to resist the urge to pace or move around out of nervousness. Anxiety is natural, but moving around increases your heart's demand for oxygen when it's already struggling to get enough. Think of it as giving your heart permission to focus all its energy on the most important job, keeping you alive. Position yourself somewhere the paramedics can easily reach you. If you're upstairs, consider coming down if you can do so safely and without exertion. If stairs feel risky, stay where you are. Paramedics are trained to reach you anywhere in your home. Before we move on, remember this. The moment you suspect a heart attack, sitting still isn't giving up. It's fighting smart. 5. Opening the door to your own rescue. Here's a step that could save precious minutes, but one that many people never think of. Unlocking your front door. Those few seconds it takes paramedics to get inside could make the difference between life and death. And a locked door can create delays you simply can't afford. If you're physically able to reach your door safely, unlock it after you've called 911 and gotten settled. Don't worry about security for these few minutes. Your safety depends on getting help inside as quickly as possible. Paramedics can break down doors if necessary, but that takes time, creates noise and confusion, and might even injure you if you're sitting nearby. Walk slowly to the door, unlock it, and then return to your safe, comfortable position. If walking to the door feels risky or makes your symptoms worse, don't do it. Your safety comes first, and paramedics have tools to get inside locked homes. Consider other barriers that might slow down help. Is your address clearly visible from the street? Are there gates, security doors, or apartment building entries that might confuse or delay responders? Think about these issues now, before an emergency, and make whatever changes you can. Some seniors find it helpful to keep a spare key in a lockbox or with a trusted neighbor, especially if they live alone. Others invest in smart locks that can be opened remotely. These aren't necessities, but they're options worth considering if you worry about access during emergencies. If you live in an apartment or condo, make sure your unit number is clearly marked and consider leaving a light on if it's dark. Some people also leave a note on their door saying, "Heart attack patient inside. Door unlocked," to make things even clearer for responders. Think about pets too. If you have a dog that might bark or get in the way, consider putting them in another room if you can do so easily. Don't strain yourself, but if it's simple to do, it can help paramedics focus on you instead of managing excited animals. Just to lock it in. An unlocked door isn't a security risk during a medical emergency. It's a bridge to the help that's coming to save you. 6. Turning your phone into a medical lifesaver. Your smartphone isn't just for staying connected with family. During a heart attack, it becomes a sophisticated medical tool that can provide critical information and support when you need it most. But most seniors don't know about the features that could actually save their lives. First, make sure you're using the speaker phone feature when talking to 911. This isn't just about convenience. It's about reducing physical strain and keeping your hands free. Holding a phone to your ear requires more energy than you might realize. And during a heart attack, every bit of energy conservation matters. More importantly, your phone contains something called a medical ID that paramedics can access even if you're unconscious. On an iPhone, anyone can access this information from the lock screen by tapping Emergency and then Medical ID. Android phones have similar features. This information can be life-saving if you can't speak for yourself. Your medical ID should include your name, birth date, medical conditions like diabetes, high blood pressure, or previous heart problems, current medications, allergies, and emergency contacts. It takes just a few minutes to set up, but it could provide crucial information that guides your treatment. Include specific details that matter. If you're allergic to certain medications, list them. If you take blood thinners, include that information. If you have a pacemaker or other medical devices, mention them. If you're diabetic or have other conditions that affect emergency treatment, make sure they're listed. Keep your emergency contacts current. Include at least 2 people who don't live in the same house, preferably people who live nearby or who could get to you quickly. Make sure these contacts know they're listed as your emergency contacts and that they have spare keys or know how to access your home if needed. Some phones also have an emergency SOS feature that can automatically call 911 and send your location to emergency contacts if you're unable to make a call yourself. Learn how this feature works on your specific phone. It might be activated by pressing certain buttons or through voice commands. Before we move on, remember, your phone already knows how to help save your life. You just need to teach it the right information. Number 7, the breathing technique that calms your racing heart. In the midst of a heart attack, when fear threatens to overwhelm you and every breath feels precious, you still have one powerful tool completely under your control: your breathing. Used correctly, this simple technique can help stabilize your heart rhythm and keep panic from making everything worse. When your heart is in distress, your natural instinct might be to breathe quickly and shallowly. But rapid breathing can actually trigger dangerous heart rhythms and increase the strain on your cardiovascular system. Slow, controlled breathing does the opposite. It activates your body's calm down response and helps your heart maintain a steadier rhythm. Here's the technique. Breathe in slowly through your nose for 4 counts, hold for 2 counts, then breathe out gently through your mouth for 6 counts. The exact timing isn't as important as making your exhale longer than your inhale. This pattern signals your nervous system to shift into a calmer state. Focus completely on this rhythm. Count silently. In 2, 3, 4, hold 2, out 2, 3, 4, 5, 6. Don't worry about breathing deeply. Just breathe slowly and steadily. If counting feels too complicated, just focus on making each exhale longer and gentler than each inhale. This isn't about curing your heart attack. It's about preventing panic from making things worse. When you're frightened, your body releases stress hormones that make your heart work harder. Controlled breathing helps counteract this response and gives your heart the best possible environment to function in until help arrives. Practice this breathing pattern when you're calm and relaxed, so it feels natural when you need it most. You can do it while watching television, sitting in your garden, or lying in bed before sleep. The more familiar it becomes, the more instinctively you'll return to it during stressful moments. If you start to feel dizzy while doing the breathing exercise, slow it down even more, or take a few normal breaths before returning to the pattern. The goal is to feel calmer, not lightheaded. Remember that this technique works for any stressful situation, not just heart attacks. It can help with anxiety, difficulty sleeping, or any time you need to feel more centered and calm. Consider it a gift you give yourself, a tool that's always available and costs nothing to use. Just to lock it in, when everything else feels out of control, your breath remains your most faithful ally. While the 7 core techniques discussed form your foundation for surviving a heart attack alone, there are additional strategies that can further tip the odds in your favor. Consider keeping a small emergency card in your wallet with key information, your blood type, current medications, and your doctor's contact information. This becomes invaluable if you're found unconscious or unable to communicate clearly. Many seniors also benefit from wearing a medical alert bracelet or necklace, especially if you have conditions like diabetes or take blood thinners, as this immediately signals to first responders that you have special medical needs. Temperature can play a surprising role in heart attack survival. If possible, try to stay cool during an episode. Loosen clothing, turn on a fan, or move to a cooler room if you can do so without exertion. Heat stress forces your heart to work harder when it's already struggling. Conversely, don't let yourself get too cold, as shivering also increases heart workload. Room temperature water kept nearby can help if your mouth becomes dry, though avoid drinking large amounts during active symptoms. Consider the timing of when you take your regular medication. If you normally take heart medication in the morning, but symptoms strike at night, don't take an extra dose unless specifically instructed by emergency responders. However, if you've missed your regular dose and it's close to your normal time, mentioning this to the 911 dispatcher can help guide their advice. Some seniors find it helpful to keep a current medication list taped inside a kitchen cabinet door, somewhere easily accessible to family or emergency responders who might need to grab it quickly. Your environment matters too. If you live alone, consider keeping a landline phone in addition to your cell phone, as landlines can sometimes work when cell towers are overloaded or when your cell battery dies. Keep important phone numbers written down in large, clear handwriting and posted where you can see them easily. Your vision might be affected during a cardiac event, making small print impossible to read. A small flashlight kept within reach can help if symptoms strike during a power outage or at night when reaching light switches feels risky. Right now, as you're watching this video, you have something precious that many people facing a heart attack don't have. Time to prepare, time to think through these steps and take action. But more than preparation, you now have something equally valuable: the knowledge that you're not powerless, even when you're alone. You have tools, options, and the ability to fight for your own life when it matters most. Every step we've discussed gives you more control over an uncontrollable situation. What stood out most to you from today's video? Which step do you think you'll act on first? Let us know in the comments below. And if this information helped you, please share it with others who might benefit. Your support helps us continue creating content that could genuinely save lives. Don't forget to subscribe so you never miss a tip that could help you stay healthy and in control of your health. Till next time, stay strong, stay prepared, and remember, you're never as alone as you think.